recording for us. We're getting underway here on Tuesday, the 26th of November. It is 2 days before Thanksgiving, so we're hopefully ready for that. Today we're going to finish up the last little segment on treatment. We are going to do about the first half of the social psychology section. Next Tuesday, which will be, December 3rd, we will do the remaining section of social psych, so the second half of social psych, and then we'll take test number 4, our final, next Thursday, beginning at 8 o'clock. Remember, I gave you guys the breakdown on Thursday in terms of the number of items, but I'll type that again up top here. So psych disorders will be 20 questions, as I mentioned previously. Treatment, which is what we're going to finish up this morning, will be 11 questions, and then the social psych section will include 9 of the questions on the test. Okay. At this point on Blackboard, you have not only your 3 test scores, but also the official clicker total, so you should see those there. That's basically adding up 8 days worth of clicker points. That total represents not just the questions, but also the attendance points as well. Remember, it was a random draw of 8 out of the 10 days, so it was not the case that you added up your 8 best days and that's going to be your clicker total. I do the draw of 8 out of 10 days. If it's a day that you didn't bring your clicker or you weren't in class, that's a day for which you would have had a 0. Okay? Are there any other housekeeping questions from you guys before we continue through the section on treatment? If there are, just raise your hand and we'll chat about whatever the issue may be. Looks like we're good. Okay, so last time, what did we talk about? Well, we reviewed these various biomedical therapies, right? These are biological treatments to intervene in some way to change the brain structurally or functionally. We talked about psychosurgery as a treatment of last resort for depression and OCD. ECT, we went through in pretty good detail on this slide, so I would suspect you'll see an ECT question on the test, right? That was the treatment of last resort, again, for depression. RTMS was on the next slide, where we looked at the application of magnetic waves, basically a large wire coil here placed above the patient's head, again as a treatment for depression. And then the final biomedical therapy was about the medications, right? And we didn't look at medications for everything, but we used depression as our example and said there are a couple different ways of treating depression in terms of these medications, and we drilled down a little more closely to look at how SSRIs inhibit the removal or the reuptake of serotonin in the synapse. By doing that, they effectively increase serotonin levels, which is something that would be helpful for mood, right? We said that those changes, however, occur pretty quickly at the level of the synapse, but clinical effects in terms of reducing symptoms can sometimes take 2 to 3 or 4 or 5 weeks for folks to feel some relief of the depression symptoms. Then we did a review of the 4 major types of talk psychotherapy. So we talked about a range along the continuum from insight with Freud on that end to action with Beck and Volpe and these cognitive and behavioral therapies on the other end, with Carl Rogers probably residing somewhere in between. Talked about Freud and his specific goal, which was to bring unconscious material to the level of conscious awareness, using techniques like free association, dream analysis, even analyzing transference reactions to the psychoanalyst. Talked about Rogers and his approach, which is a very sort of supportive approach to psychotherapy where the client is pretty much in charge of what's going on and the therapist is the facilitator here, right, providing down below their genuineness, unconditional positive regard, and empathy. Right? We talked about active listening being probably the major technique that Rogers would deploy in that client-centered therapy. Aaron Beck's cognitive therapy obviously emphasizes thoughts. We talked here when we described this together on Thursday as the catch it, check it, change it approach, right? Catch the negative thought, check the negative thought versus the available evidence, and then try to change, come up with a more balanced thought. again down below here, very often combined with behavioral techniques in something called CBT. You'll probably see more about CBT than anything in contemporary treatment outcome research. Behavior therapy, finally, was an approach to change behaviors. We want to reduce your fears, your intense, irrational fears, also known as phobias, through exposure to those phobic stimuli. And then counter-conditioning, whereby your anxiety response, which has been your typical conditioned response to that phobic stimulus, is going to be replaced with an alternative, right? And the alternative is a relaxation response. And we talked about doing the relaxation training, building an anxiety hierarchy, moving your way up through increasingly anxiety-provoking situations related to that phobic stimulus, and then ultimately exposure to those stimuli with the relaxation response being substituted in. Okay, and we looked at that in the context of a couple of other examples here, and we saw Stephanie's examples related to her cognitive behavioral treatment for obsessive compulsive disorder in that video. Okay, any questions on any of that from last time? Any of those biomedical treatments or any of those talk psychotherapies still confusing to anybody at this point? If they are, this is a good time to ask. If not, we're going to move on and talk about treatment outcome research for about 10 minutes or so. All right, good, let's do that. We're going to take a look at two big questions related to evaluating psychotherapy outcomes. And the two questions are these. Number one, does psychotherapy work better than no therapy at all? In other words, if I had, let's say, major depression, or I had generalized anxiety disorder, is it worth my while to get treatment, or is it just a waste of time and money? Okay, so basically question number one asks, is doing something better than doing nothing if I have depression or, let's say, GAD? Second question about psychotherapy outcomes has to do with winners, right? Do some kinds of therapy tend to work better than other kinds of therapy? In other words, if we were to try to evaluate those different brands, right? Cognitive therapy, behavior therapy, maybe Rogers and his client-centered therapy, or even psychoanalytic approaches, Freud, right, doing psychoanalysis. As we look at those treatments, do we find any differences in terms of outcomes, right? This is sort of like a Consumer Reports question here, number two, right? Are some brands of dishwashers better than others? Are some brands of psychotherapy better than others in the case that we're talking about? So let's look at the first question off the bat here. Does doing something work better than doing nothing? And the way that we actually arrive at the conclusion that will help us answer that question is by doing something called a meta-analysis. So let's take a look at that on the next slide here. What's a meta-analysis? A meta-analysis is a statistical approach via which we can combine the results of lots and lots and lots of different studies to arrive at one overall conclusion. Okay, so that's kind of the point here of meta-analysis, is give me one takeaway, right? If I were to summarize this over Thanksgiving dinner on Thursday, does psychotherapy work better than doing nothing at all? Meta-analysis will let me do that. So how does this work? Without getting too technical here, meta-analysis basically statistically combines the results of, let's say, 35 studies on cognitive behavioral treatments for depression. Let's say that there are 35 such studies that have been published, okay? And this meta-analysis, rather than listing those 35 studies in something like a giant table, right, in a Word document, saying Smith and Jones in 1996 found this, and Johnson and Williams in 1999 found that. Meta-analysis basically crunches all those numbers together. These meta-analyses have been done, and we look at treatment versus no treatment. Here's what we find down below. The average person who receives therapy is better off at the end of it than are 80% of the persons who don't receive therapy. Okay, so look at what that says. Let's parse this closely together, right? The average person who receives therapy, that basically means the average person in the experimental group getting, let's say, the cognitive behavioral treatment for depression is better off at the end of it than are what? Than are 80% of the folks who don't receive therapy. Tell me in the chat box, Which group are these guys in? The folks who don't receive therapy at all. In our experimental design to look at treatment outcomes, to which group have they been randomly assigned? What kind of, well, it's not necessarily a placebo group. What's the more generic term? They're in the control group, right? So the folks up above here, if we want to be very explicit about this, these are the folks in the experimental group, and they receive, let's say, the cognitive behavioral treatment for depression. The folks in the bottom here are in that control group. Now, it might be a placebo control group, depending on the specific design of the study. But what I want you to understand is what this statement says and what it doesn't say. Okay? It says that if you grab the average person from the group of folks who've actually gotten treatment, that average person who went and got the treatment is doing better than 4 out of 5 of the folks who didn't get any treatment at all. Okay? It doesn't say that the treatment has an 80% success rate. It doesn't say that they're 80% less depressed than they were before. It says if you look at distributions, if you look at the range of possible outcomes at the end of treatment, the folks who get treatment are doing better than most of the people who did not get treatment. Okay? So the question up top says, does psychotherapy work? The answer is yes. Okay? Doing something is better than doing nothing. If you have major depression, if you have generalized anxiety disorder, etc. Okay? Doing something is better than doing nothing. How can we look at this visually? If I go to the next slide here, we have a depiction of these distributions both before and after treatment, or comparing the control group to the experimental group. So here's the average untreated person. I'm going to drop a line down here. And if you look down the bottom with me, on the x-axis, what do we have? A rating of outcomes from poor outcomes on the left to good outcomes on the right. Okay? So here, at this point, we have the average untreated person. Right here is where they're falling on that range of outcomes down the bottom. Let's be very explicit and say these are the folks in the control group. Okay? So the blue distribution represents the control group. What happens when you get treatment? When you get treatment, we basically nudge your distribution in which direction? In the direction towards better outcomes, such that now your average outcome for the folks who got treatment in the orange distribution is over here. Okay, so let me drop a line down here, and I'll even do it in an orangish color for you. Okay? Here's the line, the dotted line right here, that represents the outcome for the average psychotherapy patient. That's what it's listed as up above. Let's say that they're the ones in the experimental group, right? They got the treatment. Effectively, what I'm telling you here is that treatment nudges you from over there to over here. It nudges you where? Towards better outcomes. And at the end of this, the average person right here along this orange line that we drop down in the middle of the treated distribution is doing better than what? Doing better than most of these folks over here in the blue control group distribution. I'm going to put stripes on that because this striped area now represents what percentage of that blue distribution? Tell me in the chat box. What percentage of that blue distribution now falls below the average treatment outcome for the folks who got treatment? I'm going to put a number on it. Exactly. Thank you, Tiffany. So this is now 80% of the untreated distribution is now falling where? Is falling into a worse outcome than the folks who actually went and got treatment. Again, the folks who got treatment are the folks in this orange distribution right here. Okay? So basically what we're saying is treatment nudges you from a worse outcome towards a better outcome. Okay? Does it result in everyone doing better? No, it doesn't. Okay? Because we could actually come over here and maybe in this reddish color stripe this little segment of the untreated distribution and say, you know what? There's the 20% of the folks who didn't even get treatment who ended up doing better than the average person here who went and put in the time and money and effort to get treatment. Okay? Again, the take-home message is summarized probably most neatly down the bottom here. What does it say? 80% of untreated people have poorer outcomes than the average treated person. So if you were betting on this, the odds are stacked in your favor. Effectively, you have a 4 in 5 chance after treatment to be doing better than someone who had the same problems as you but opted not to get treatment. Okay, that's probably the cleanest way I can describe it for you, right? After treatment is over, your chances are 4 out of 5 that you'll be doing better off than somebody said, no, I'm not going to do anything about this depression or this GAD. Let me just ride it out. I will stop there now. Questions about that at all? Make sense? I think it's a pretty straightforward kind of idea here. All right. Let's take a look at the second question. How did we frame that second question? It was, do some kinds of therapy work better than other kinds of therapy? In other words, are there certain brands that seem to come to the top here when we look at this? Now, I'm going to summarize this in this way by saying that the answer to that question, do some kinds of therapy work better than others, is that most therapies seem to work out about equally effective. Most studies suggest that these various forms of talk psychotherapy are about equally effective. Now, this is in the aggregate. That's a fancy way of saying overall. Okay? Equally effective in the aggregate. I'll put in parentheses down below overall. That means if you combine all treatment outcome studies for all disorders, and you've got one pile that's cognitive therapy, a second pile that's behavior therapy, and a third pile is client-centered therapy, and a fourth pile is psychoanalytic therapy. When we compare the outcomes across those 4 piles, we don't see giant differences. Why? How is that possible? Freud has you talking about dreams. Volpe has you handling snakes. Aaron Beck has you tracking your negative thoughts. How can you get similar outcomes on the back end when what they do with you is so drastically different? Well, there are common factors across those treatments, and those common factors are listed right here. All of them, regardless of specific techniques that they use, help you address emotional situations. They help you think about and talk about and process mood symptoms, anxiety symptoms, other kinds of problems. They give you an opportunity here for interpersonal learning. You can learn from other individuals, right? Maybe it's the therapist, maybe it's other folks in a group. Maybe you're in a treatment group for folks who are depressed or anxious. You get a new perspective on your own problems. And then finally, these therapies all involve an empathic, trusting, caring, really a very unique relationship here with another human being, right? Somebody who's there with their sole purpose being to help you get better, to help you feel less depressed, to help you feel less anxious. So whether they're making you analyze dreams or track your thoughts or handle snakes, regardless of those differences at the level of specific techniques, all of them are doing these things for you, okay? The field has progressed in the direction down the bottom here where we're starting to see some specific treatments being developed for specific patients. These manualized, empirically supported therapies are basically treatment handbooks, if you will, that guide the delivery of the treatment. So you could have a manualized treatment for depression that is cognitive behavioral in its focus. I've seen these. I've worked with these. I actually helped write one of these for folks who had both major depression and a substance use problem. Right, where you spell out in session 1, here's what we're going to do. In session 5, here's the focus. In session 8 and 12 and 15. Okay. The good thing about this is the phrase down the bottom that says empirically supported. This effort within the treatment outcome research literature is terrific because it's helping us to eliminate the stuff that does not work. Right? Empirically supported means subjected to clinical trials like we just described, a control group and an experimental group. Good, reliable, valid measures are employed and all of that, and we see if, on the back end, the treatment actually led to a decrease in symptoms. Okay? This helps us get rid of things that don't work within the treatment area and helps us to bring to the top and try to get more treaters doing the kinds of things that do work, that actually are effective, is what I'm trying to say here. Okay? Let me stop there for a second. Any question about the answers to these 2 big questions? right? So the answers to these two big questions that you could summarize around Thanksgiving dinner on Thursday is, yes, doing something is better than doing nothing. And overall, the various psychotherapies are about equal. Now, when we drill down, and I'm going to do that in a second with you here, to look at individual treatments for specific disorders, there might be some winners in the area of depression, or some winners in the area of anxiety or schizophrenia or whatever. Okay? But when we roll all of that stuff together and come up with this overall finding, we don't find significant differences across those different treatment approaches. Okay? Questions or confusion about any of that regarding treatment outcome studies? A nice way to review some of the basics of research methods, right? Experimental design, control groups, experimental groups, random assignment, reliable and valid measures, and all that good stuff from back in the first part of the course. All right, then let's share briefly together this list of 3 slides. I'm not going to ask you any test questions on these 3 slides. This is the public service announcement part of the treatment section. I said this last week, right? If you never take another psychology class, you should be able to look back at your notes here when your cousin or your neighbor or your roommate has problems with anxiety and they ask you, you took psych? What should I do for this? Well, clearly for anxiety disorders, they need to go in and get cognitive behavioral treatment. These are the treatments that work best. It could be systematic desensitization for phobias. That's what we talked about when we described what Joseph Volpe would do with you on Thursday, right? Cognitive behavioral treatment for panic disorder. That's David Barlow's treatment that involves inducing panic-like symptoms, right? The heart rate, the dizziness, etc., the rapid breathing. And then we break that connection that we talked about in the section on etiology of anxiety disorders between physiological arousal and then those catastrophic thoughts. And then we saw exposure and response prevention in class on Thursday, right? That was Stephanie getting the treatment, rubbing her hands all over the sofa, spreading the germs, exposing herself, and then not engaging in those compulsive behaviors. In terms of depression, there's no single best way to treat depression. We already have seen that antidepressant medications work about 2/3 of the time. Cognitive behavioral treatment is about as effective as medications. We see some studies where it's a little bit better, some studies where it's a little bit worse in terms of outcomes. Actually, the best sort of state-of-the-art treatment for depression would be a combination of any of a variety of different antidepressant medications and cognitive behavioral therapy. In fact, when you do that combination, the combination works better than either of those individual components work by themselves. Okay, so when you blend them together, you get the best outcome. So if you have a neighbor who has major depression and she's wondering about what to do about that, I'd say she needs to get started on an antidepressant and she needs to get involved in some kind of cognitive behavioral treatment for the depression. And then finally, for schizophrenia, we know that medication treatments are superior. We can use this to remind ourselves, particularly for those positive symptoms, right? Those things that are added in that aren't present in quote-unquote normal people. So that's hallucinations, delusions, thought disorder, motor disturbance, etc. Social skills training is often deployed within the context of treating schizophrenia to address social skills deficits, things that are missing. That's typically done in an outpatient group setting. So you come in every week or maybe every other week. What's nice about those groups is they can also be a place where we focus on medication compliance, right? Adhering to the medication regimen so that you're going and taking the medications as you're supposed to. Okay, that's another nice side effect of those social skills training groups. All right. That is everything I've got on treatment. Before we turn the page on that, does anybody have any final questions before we start talking about social psych, which is our final section of the entire course? Okay, let's take a look then at the beginning of the section on social psych, and let me sort of orient you to how we're going to approach this whole section here. So social psychology is a very broad subdiscipline within psychology where you could cover everything from intergroup relationships to prejudice to attitudes to social influence to obedience and so on. I sort of boiled down to 2 big topics for us. We're going to talk about social influence, and we're going to talk about social thinking. So let me explain to you what each of these are going to involve. Social influence up above is going to include, first at the beginning, a discussion of something called social facilitation. Okay? The ways in which the presence of others can facilitate our performance, okay, can help us perform better than we otherwise would. Okay, we'll take a look as well at conformity research, and by the time we get done today or at the very beginning of next Tuesday's online session, we'll be talking about obedience. So these are three big topics that would fall under the heading of social influence, right? Social facilitation: does the presence of others enhance or hamper my performance? Conformity: what goes on when there's a pressure to adhere to the opinions and attitudes and beliefs of other people around me? And what about obedience? Okay, how do we get people to obey us, to potentially even do things that are pretty horrific in retrospect? Okay, we'll talk about that today. Next week, on Tuesday, when we get to our final online session before the test, we'll be talking about social thinking. And there we're going to focus on these things called attributions. If you're wondering what those are, I'll tell you what they are here. They're explanations for others' behavior. Okay? So when someone else does something and we're observing their behavior, sometimes what we do is we wonder why. Why did they do what they did? Okay? Why did that person cut me off as I was driving down the road? Okay? Why is that employee at the store being so mean to that customer, right? Why is that one professor yelling at that other professor, right? To what do we attribute their behaviors? What explanations can we come up with for their behavior, right? Why do some people, when an entire community is told to evacuate, why do some people not leave? Why? Right? That's the basic question attributions try to answer, right? Explanations for others' behavior, basically boiling down to answering the question, why? Why are they doing what they're doing? So we'll get to that. We will focus this morning, though, on these topics up above, right? Social influence, including these three subtopics: social facilitation, conformity, and obedience. And the way that we're going to approach this is by reviewing a bunch of really interesting, really creatively designed studies that tap those specific constructs there, those specific variables. So let's talk about what social psychology does more generally, right? It's a way to scientifically study how we think about, how we influence, and how we relate to one another. Okay, so when I have the phrase here, how we think about, that's where next week's section on attributions are going to come in, right? How we think about others, how we influence others. That's our focus this morning, right? Social facilitation, pressures to conform, pressures to obey figures of authority, right? And how do we get along with other people? You read about those sorts of topics in the textbook for sure, okay? What we're going to do this morning is review about 4 or 5 studies on social influence, and then we'll be in position to move into the section on attributions next week. Okay, so how can we think about social influence? Well, I've got a couple pictures here designed to help you think about different ways in which social influence can manifest itself. And I've got a picture here from Qualcomm. This is back in the old days when the Padres still played there, because we still got the baseball field set up at the beginning of the football season. We could talk about social influence in really 4 different ways just with this slide alone. So we could talk about what I'm going to call one-to-one social influence, where one person can influence another person. It could be the offensive coordinator talking to the quarterback. It could be the defensive coordinator talking to a linebacker. Okay? It could be one of the medical staff talking to someone who has sustained a concussion. Okay? One-to-one social influence. We could talk about one-to-many social influence on the slide. Can you think of something that one person could do that would affect the behavior of tens of thousands of other people? Tell me in the chat box. What could one person do during this football game here that would make lots of people really, really happy, or lots of people really, really angry? One-to-many social influence. What might one player do? They might score a touchdown, right? They might kick a game-winning field goal, right? One individual person might run across the field, closed or maybe unclosed, right? So those are all good examples of ways in which we can have one-to-many social influence. Let's go many-to-one, right? So we can see all the permutations here. What is something that lots of people in this crowd could do that would maybe negatively influence the performance of a player on the other team? Well, the crowd could get really, really loud, right? If they scream so loud and cheer so loud, it might make it difficult for one of the offensive linemen to hear the count from the quarterback, and he might move early, okay? And now we've got a legal procedure on the offense, and that's a 5-yard penalty, many-to-one. Lots of people negatively influence, or maybe positively influencing one person. The only permutation left is many-to-many. Right? Could we have subgroups within the crowd here who are interacting in a way to try to influence each other? Well, we could have down here a group of Chargers fans, and over here maybe this is the Raiders game. This is a bunch of Raiders fans. Many-to-many social influence, right? The Raiders fans are yelling at the Chargers fans. The Raiders fans are throwing old car batteries, small babies, sheep over at the Chargers fans there, right? There's many-to-many social influence in action, okay? So lots of different ways to see social influence at work in this kind of a context, and that's what we're going to be drilling down to when we look at some individual studies in just a few minutes here, right? I said under the heading of social influence, if I go back to our title slide for a second, we were going to be talking about social facilitation, we were going to be talking about conformity, and we're going to be talking about obedience. Let me show you a picture that I won't leave off for too long because it's pretty darn disturbing, that shows you obedience at probably its worst. It's worst, right? This one. Pictures from the time of the Nazis where we have German soldiers here shooting people in the back of the head and pushing them into this mass grave, right? You might look at that and say, how in the world do these guys here agree to obey orders that involve shooting other innocent people in the back of the head and kicking them into this mass grave? How does that ever happen? Okay. Well, we're going to talk about social psych research that actually illuminates some of the mechanisms through which that level of obedience can occur. And if you think it only happened back in World War II and that contemporary people wouldn't be so obedient, think again. We have plenty of contemporary examples of people obeying authority figures and doing things that are horrific, right, including flying airplanes into buildings, people blowing themselves up in the marketplace, all over the place. So we'll talk about that research by the time we get done today. That's going to look at the research done by Stanley Milgram. So let me ask you a quick little question here and set up the tools for the polling so that they will work right for us here. Just given what you know right now, think about this one. The presence of others would enhance the performance. That is, would improve the performance of which of these folks right here? Take a look at it and then choose A, B, C, or D to respond to that, and we'll see what you guys think on the front end, and then we'll come back and revisit this question in just a little while. I'll give you guys a minute to take a shot at that one. Okay, I think we're pretty good here. Let me pop the results out for you guys into the screen there. There we go. All right, so 10 out of the 15 of you who responded said it was Joe, the expert juggler, who's been juggling for 10 years, that the performance that Joe would give would be better if there were other people around, right? The presence of others. This is all going to be about something called social facilitation. Well, let's look at the research that illuminates this, and we'll come back to this question again. This research was done by Norman Triplett in 1897 at Indiana University in Bloomington. It is the first social psychology research study ever done, And Triplett was trying to answer the question down below here. Why do bicycle racers, right, in something like the Tour de France or whatever, tend to have better times when they're in a head-to-head competition versus when they would compete across that same course in a time trial, right, when they're competing effectively against the clock? Okay, why is that? Okay, can you think of some explanations for that? And if you can, share a couple of those ideas in the chat box, right? Why might some people, or why might maybe most people, tend to do better in a head-to-head competition than they would do if they were racing face-to-face? I'm sorry, if they were racing against the clock. People are looking, okay? So there's a social element here, right? There's a crowd watching, okay? But there could be a crowd watching if it was a time trial, okay? But there are other people that they're competing against, I guess, here when it's head-to-head versus the clock. What happens when you're in a head-to-head competition like that versus when you're just doing a time trial? Is there any kind of physiological or social or psychological variables that are relevant? People are maybe feeling an adrenaline rush. I like the way you're thinking about that one, right? So there's a physiological reaction to that. What about like the personality variable of competitiveness? Are some people more competitive than others? Absolutely, right? Maybe they're going to be more driven to do something better in that head-to-head competition. Well, remember, Norman Triplett, trying to do this research back in 1897, has to be pretty creative if he is sitting in his research laboratory and he's trying to create something that will mimic what goes on in the real world. Okay, if he's trying to mimic what goes on in a bicycle race or some other situation where you are going head-to-head in some kind of competitive situation. So what Triplett decides to do in this first social psychology research study ever done, his dissertation back in 1897, is to have young children from the community come in and have these youngsters reel fishing line. I'm not making this up. They're going to reel fishing line either alone, that's kind of the time trial scenario, right, against the clock, or against a partner. Okay, here is the device he used, which he rather grandiosely called the competition machine, and here's what Triplett found. His results are listed down below, right? Most children reeled the line more quickly when they were in there with a partner, okay? But some children did so more slowly, okay? So here's the take-home answer to the question here, the Triplett phrase. Are we influenced by other people? Yes, okay? The majority of people actually have their performance enhanced when they're in that against a partner condition, okay? But there are some kids who actually do worse in that condition. They actually reel the fishing line more slowly when they're in there with another child than when they're in there by themselves. Let me ask you this. Are there certain kinds of kids with certain kinds of characteristics who in this some children did it more slowly category might do worse? Can you think of something that might explain why some kids are doing this worse in that bottom condition? What kinds of children might do worse in the head-to-head competition than they would do just in there by themselves reeling the fishing line? I'd be curious to hear what thoughts you might have. I see a bunch of people typing some things. Kids who are anxious, kids who are not experienced, kids who don't like competition. All really, really good answers. Very, very good. Okay, so let me tell you what happens here. For the next 65 plus years, this kind of what's called social facilitation research. So let me put that title right on the side here with Triplett, right? This is called social facilitation research. Again, it looks at the degree to which our performance is going to be either hampered or made better by the presence of others. Okay, this social facilitation research persists for 65 years or more. Okay. Again and again, we get this repeated mixed finding. That's what I would call this, right? Most doing better, some doing worse. Most doing better, some doing worse. Again and again and again. Whether it's with humans, whether it's in this kind of situation where you're reeling a fishing line or doing some other kind of activity, and actually in animal research as well. Okay, we find this repeated discovery that most do better, but some do worse, again and again and again and again. Along comes Robert Zionts in the mid-1960s. So let me give you a phonetic pronunciation of this very difficult name. Zion, Z-Y-O-N-T-S is how you pronounce that. And he produces or proposes a resolution to these mixed findings. Again, most doing better, some doing worse, from social facilitation research. Here's what Zion says. There's a fork in the road where most do better, but some go down the other fork and actually do worse. Zion suggested that the presence of other people, people watching you do what you're doing, increases arousal. And arousal is the fork in the road. Arousal is something that enhances dominant responses, but it actually works against you if it's something with which you don't have much experience. So let me explain to you again what a dominant response is. A dominant response is some behavior that you have lots of experience doing, right? So teaching Psychology 101 would be a dominant response for me. I've been doing it for 14 years now, pretty much have got this nailed down, right? If you played soccer from the time you were 4 and you're now 15, that's a dominant response for you. If you had never played tennis before, or you have never played the piano before, those are not dominant responses for you. Those are what we're going to call novel behaviors. So here's the summary down below of Zion's resolution of this mixed set of findings from social facilitation research over 60 years. It says, social facilitation will cause well-learned behaviors to be performed better, the psychology lecturing or the playing soccer, and it will cause novel behaviors to be performed worse. Okay? That would be playing tennis or playing the piano if you've not ever done those things for very long. Okay? If you're a newbie at something, that's what a novel behavior is, right? Something at which you're a newbie. So in other words, if we had you play tennis as a novel behavior for yourself, you've been playing for a week, okay, and we had you play tennis, just you and your coach, and then later in the day we had you play a match in front of 15,000 people. What we're saying is that in the condition with lots of people watching you, with 15,000 people there, you're actually going to play worse than you would when you're just there hitting the ball around with your tennis coach. Okay. However, if you are a world-famous tennis player who's been playing for 20-some years, okay, the presence of others is actually going to facilitate your performance of that well-learned behavior, right? So a well-learned behavior is something that you have done again and again and again, something with which you have lots of experience, right? So well-learned means lots of experience, whereas novel means you are a quote-unquote newbie at it, okay? So what does this mean? It means that if you're trying to do your best, if it's something you're really experienced with, bring on the crowd. Let people watch, no problem. It doesn't matter. Okay? If you're relatively new at doing this thing and you don't have a lot of experience, actually having a whole bunch of people watching is probably going to work against you. Okay? That's what explains the fork in the road. And again, the key variable here, the pivot point, if you will, that fork in the road really is arousal. Arousal is not uniformly positive. Okay, arousal works in your favor when it's something that you're well experienced in doing. Arousal works against you, and it sort of makes you tense up and mess up if it's a relatively new behavior for you. Okay? Let me stop there for a second. So we've talked about triplet and the kids reeling in the fishing line. Pretty creative way to create a social facilitation situation in a research laboratory. And now researcher number 2 here, Robert Zionts, is explaining that fork in the road, which is arousal. Works to your benefit if you're doing something that's well learned. It works to your detriment if it's something that's new to you. Questions on that at all? If you do, just raise your hand. You probably won't be the only one if you do have a question. Okay, hey, let's go back to that question I asked you at the beginning here, and let's try to answer this one again. Okay, the presence of others would enhance the performance of which of these folks here? Joe, Cassie, Jeremy, or Tracy? give that a shot. All right, let's take 10 more seconds on this one. Excellent. Thanks, guys. Let's take a look. Now everybody who's answering is getting it right. Yes, Joe, the expert juggler who's been juggling for 10 years, because that's a dominant response. The rest of these folks are newbies, right? Cassie, the piano player, Jeremy playing tennis, Tracy doing the dental hygienist thing. Those other three, B, C, and D, are all newbies at their specific behaviors. Okay, let's take a look at social psychology research now. Focus on conformity. So let's go back to our title slide on social psych, and we said we talk about social facilitation. We've done that. That was Triplett and Zions. Let's talk about conformity. This is going to introduce us to the research of Lucifer Sharif and another researcher named Solomon Asch. So let's take a look at Sharif and Asch with this study here. Okay, so are we influenced by other people in situations where we don't have a good reference point? Okay, Sharif makes use of a technique in his research known as the autokinetic effect. So what is that? The autokinetic effect is basically analogous to what Triplett did in trying to create a situation that involves social facilitation, right? So this is analogous to Triplett's fishing line. That is, it's the methodology, right? It's the method that he's going to use to study what? Look down the bottom here. To study how people respond and how they're influenced by others when they don't have a good reference point. The key word here that we're going to be discussing is how do people respond in what we might term ambiguous situations, where what's going on is not exactly totally clear, where we don't have a good point of reference. So let me tell you about this autokinetic effect method up above. It's a technique that he uses in his research laboratory to create an ambiguous situation in that laboratory. So what does he do? He has people come in and they're in a completely darkened room and they're staring at a dot on the wall. Okay, they're staring at a dot on the wall, and after some period of time, that dot on the wall, right, like the laser pointer on the screen in AL201, right, on a Thursday, that dot or that laser pointer dot will appear to move. Okay, that's what's the autokinetic effect. That's what he's using in his research, right? The autokinetic effect refers to the apparent movement of this dot on the wall, even though it's actually not really moving. Okay, so why is he doing this? Again, he's trying to create ambiguous situations in his laboratory that would mimic what goes on in the real world. What would be a real-world ambiguous situation? Well, let me just make one up, right? It could be something like this. You are walking through the mall on Black Friday, and there's a group of, let's say, 3 15-year-old boys. And, well, 3 15-year-old boys do some strange things sometimes. And what happens is one of the 15-year-old boys falls on the ground and starts flailing around. The situation is ambiguous because you don't know what's going on. It could be a seizure. He could be having a heart attack. He could be dancing. He could be just goofing around, right? You don't know. So how do you figure that out? Tell me in the chat box. What would you do in that situation to figure out whether that was a seizure or a dance competition or he was just goofing around with his buddies? How would you figure out what's going on there? Exactly, Elaine. Perfect. Right? You would look at his friends' reactions, right? You look around to other people. That's exactly what Sharif thought would happen, and that's exactly what does happen. When his participants came into the room in this first condition, individually, and they were asked, how much movement did you see on the dot on the wall? How much did the dot move? Their estimates initially were all over the place, right? There was no degree of consistency in their responses initially. On subsequent days of participation, Sharif had them come in, not by themselves, but in a group with a couple of other people. Look what happens to their estimates as they're in that room with other people in this ambiguous situation. What happens to those estimates? They converge until ultimately what happens is all of the estimates are basically right on top of each other. So what does this mean? This means that when things are not clear, when we don't know perfectly exactly what's going on in our social world, we scan the environment, and like Elaine said down below, we look at others' reactions. We look at what other people are thinking or saying or doing, right? I'll give you other situations that are ambiguous. You know, if you're working in an office building and the fire alarm goes off, most people don't go running out of the building immediately, right? It's like, oh, is there something really going on? You poke your head out of your office. Is this a fire drill? Did somebody bump into it by accident? What's happening, right? We look around to others, right? Or another situation, turn it into something fun. You're walking through the mall again. There's some kind of competition going on. There's a little table set up. It's some kind of fundraiser, right? If you pay $1 to the Cub Scouts, they'll let you guess how many jelly beans are in this giant container, okay? Well, initially, if you did that with you giving your estimate by yourself, estimates probably will be all over the place. One person might say 800, another person says 8,000, another person says 12,000. In that situation, if you did those estimations together, you probably would see, again, this convergence of estimates that Sharif found. Again, the key word being here, ambiguous situations. That's what you got to stamp into your mind here when you're talking about Sharif's research. All right? Let me stop there for a second. Questions about Sharif's research regarding ambiguous situations? If you do, just raise your hand. Awesome. Okay. What if we take the ambiguity away and make the situation not ambiguous, but instead totally and completely obvious, where we give you a situation where the answer that is correct is extremely clear, right? It's not clear with the autokinetic effect in Sharif. You're in this dark room, there's a dot on the wall, you have no point of reference, it's not clear what's going on, and so you defer to the people around you in some way. Solomon Asch comes along and says, are we going to be influenced by other people if the answer is not ambiguous, but instead obvious, right? Are we going to be influenced if there's an obvious correct answer? This is in 1955, so we've fast-forwarded ahead 20 years from Sharif's research with the ambiguous situations, and Asch is hypothesizing in the mid-1950s here that people are not going to be influenced when there is objective, straightforward, clear information, right, where the answer is not difficult, okay? Okay, what do you mean the answer is not difficult? Well, we're going to bring you into a research laboratory. Pretend this, right? It's the mid-1950s. And we're going to have you do an obvious task. The obvious task listed down below here is to have you match a line with a series of 3 other lines. Let me give you a picture of what this task looks like on this very next slide. The red line on the left, tell me in the chat box, is the same length as which of those 3 lines on the right? Is it 1, 2, or 3? Clearly, obviously, without any doubt, it's number 2. Okay? So, he's creating, again, a situation where the answer is obvious, it's clear, there's no ambiguity. Sharif is your ambiguous situation guy. Asch is going to be your obvious situation guy. So how is he going to use this as a way to study what? Conformity. He's going to study conformity by having you come in and look at one line and match it to 3 other lines. But you're going to feel a pressure to conform. Conform to what? Conform to other people's answers. Take a look at this picture. It's one of my favorite pictures that we ever do in this entire class. This poor guy in the tie, leaning forward with the glasses on there. And if you had a thought bubble, right, I just, I don't like, doing this stuff too much. But if we had a little thought bubble coming out of this guy's head, and it's really hard to draw a thought bubble here with the mouse, what words would be coming out of his mind at this point? He is like, what the? Why does he look so confused? Because you see the little number 6 in front of him right here? The first 5 people in answering this question on the left, which of these 3 lines is the same length as a standard line? They have all said 1. Clearly, obviously, the answer is not 1. Okay? But what's his study about? His study is all about conformity. When the situation is obvious, will you feel the pressure to conform, and will you go along with the obviously incorrect answer? Because this guy sitting next to you, and the first 5 people sitting next to you, in fact, have all said that the correct answer is 1. And you know, for the love of God, there's no way that the answer is number 1. Okay? But they have all said 1, 1, 1, 1, 1, straight on down the line. So my question for you is, what percentage of the time do you think that people in this study would go along with the obviously incorrect answer here? Are they going to do that less than 10% of the time, 10 to 25% of the time, 25 to 50% of the time, 50 to 75% of the time, or more than 75% of the time? What's your guess? How often will they go along with and conform to the obviously incorrect answers given by the first maybe 5 participants here in this study? I'm just curious to see what you guys are thinking here on this one. I'll give you another 10 seconds on this one. All right. Now, most of you guys are thinking, yeah, this is probably going to happen because Dr. LeMahieu, you're spending all this time building up to something that's probably pretty dramatic. It is actually still pretty dramatic. More than a third of the time, people will go along with the obviously incorrect answers of those other people in the room with you. So who are those other people in the room? Let me go back for a second. These guys here, this guy, in fact, the first 4 participants we can't even see in the picture are what are known as Confederates. Okay? What are Confederates? They are participants who are not real participants. They're basically planted there by Ash to give these obviously incorrect answers. So obviously in this study, there is lots of deception, right? In fact, the study is framed for you as being a study about visual perception. Ash doesn't say to you, this is a study about conformity, and we want to see if you want to go along with obviously wrong answers. So he misleads you or deceives you there. He misleads you or deceives you by having these other folks who come in and say 1, 1, 1, 1, 1, 1, 1, when you know the answer is clearly 2. Okay? So what happens is you misjudge the line more than a third of the time, and as the number of Confederates grows, your misjudgments become more frequent. Basically, till we get to the critical point here of about 5 to 7, right? Somewhere between 5 and 7 Confederates, we see the maximum effect of their presence and the pressure that you feel from them to conform to their wrong answers. Okay? That's about where we see this maxing out. Once we get to that point, if you see it here, basically the curve pretty much flattens out, right? The curve pretty much flattens out from this point where you don't become increasingly likely with 8 or 10 or 12 or 15 Confederates answering incorrectly before you and saying 1, 1, 1, 1, 1 when you know the answer is 2. Okay? So, the take-home message here is what? The take-home message here is it's not just in ambiguous situations where we are influenced by others, right? That was Sharice's research, and we clearly are in that situation. When we don't know what's going on, as we said about the mall example, we look to see how other people react. Ash's study, shockingly to him, is one that shows that even if the answer is obvious, we are still very much prone to responding in such a way as to conform to the opinions of other people, right? We don't like going off and saying something that goes against the grain here, okay? That's what we're trying to get at with ASHA study. When the situation is even obvious, we are still likely to conform to the opinions of others, okay? Let's do one more quick polling question, and then we'll take a look at Milgram's study in our last 15 minutes. All right, Sharif's research utilizing the autokinetic effect methodology demonstrated the tendency for people to conform to the opinions of others in what kinds of situations? Was he studying competitive situations, obvious situations, ambiguous situations, or erotic situations? I'll give you guys another 10 seconds for this one. And again, to answer this, all you got to do is click on the little letter up above the list of participants. And when you roll over the little A, it will show you A, B, C, or D. All right, let's take a look at the results here. All right, so 12 out of the 15 responses went with ambiguous, right? Ambiguous situations, that's what Sharif's research is all about, right? Obvious situations, that's what ASHA's research is all about. Well, let's kick this discussion of social psychology all the way to the edge where we said we want to talk about obedience, right? We had that disturbing picture from the Nazi era, people shooting other people in the back of the head and pushing them into these mass graves. What the heck is that all about? How do you get that kind of thing going on? How does that level of obedience ever occur? That's what was just troubling Stanley Milgram to no end in the mid-1960s. He wanted to answer the questions up above. Are we influenced by other people? Sure. What about to the point where we perform harmful behaviors? He wanted to answer this question. Why did people follow orders like that during the Holocaust? Okay. He wanted to answer this question down below. Would people follow the orders of an authority such that doing so would potentially kill another human being? Right? Now, we've seen lots of creativity already in the social psychology research we've reviewed. We had Norman Triplett looking at social facilitation by having little kids reel fishing lines. We had Sharif with people sitting in a dark room staring at a dot on the wall. Right? We had Solomon Asch having people come in and stare at lines and see if they're going to go along with wrong answers when the answer is 2 and everybody else is saying 1. Are you going to say 1? So Milgram, in that same spirit, has to come up with a creative way to study obedience. He can't just ask you the question down below here, right? If he asks you this question here, how are you going to answer? Tell me in the chat box. If I asked you, would you follow an authority figure's orders such that doing so you might kill another human being? What are all of you going to say in response to that question? Everyone is going to say no. No, 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 no. I would never do that. Well, obviously, people do those sorts of things and follow those sorts of orders, and people are really obedient. So he needed to come up with a study that was going to be creative to help him answer this question about why people did what they did during the Nazi era. So he created a study about obedience that involved a teacher and a learner. So we're going to start with the idea that there's lots and lots of deception in Milgram's research. Okay? He's going to do the study with you regarding a teacher and a learner. And here's what he tells you. When you come into his laboratory, he says, we're doing the study about learning, and we're trying to find if there are ways of using punishment to help people learn more quickly. Okay? So you come in as the true participant, this guy right here, and you come in with another participant here who is actually, again, a confederate of, in this case, Milgram. So let me type across his chest here, his belly, confederate. Okay? The confederate is always going to be randomly assigned to be the learner. Okay? So the confederate here is always the learner. You, as a true participant, are always going to be the teacher. Okay? So what does the teaching and learning involve? Well, the learner is first set up in this adjoining room, adjacent to this room that has the shock generator. And the learner is going to have a series of 20 word pairs read to him. So it might be ball and then tree, flower and then sky. And we go through that list. So we go back to the top and we read the word ball, and you have to tell me what word goes with it. Is it tree, flower, bee, or dog? Okay. It was ball, goes with flower. Okay, great. If the participant, the learner, gets things right, there's no consequence. If he gets things wrong, you are to deliver a shock. Now, look, as we get him set up back here, you actually see him have these metal plates connected to his wrists. He has a little response pad, effectively, in front of him. And every time he gets something wrong, you're going to deliver a shock to him. Okay? He gets it wrong. He gets it wrong, you give him a shock. If he gets it right, you don't do anything. Just before you leave the room, the Confederate here, the guy in the suspenders, says to the white lab coat Nazi guy, right? He's the authority figure, by the way, right? The guy in the white lab coat. The Confederate learner there says to the authority figure, I just wanted to let you know, Mr. Authority Figure guy, that I have a heart condition, and I was a little bit concerned about my heart condition in light of being given shocks. The white lab coat guy says, the shocks are painful but not dangerous. Okay? Painful but not dangerous. That is kind of funny if you think about it for a second, right? It's going to hurt, but they're not going to kill you. Okay, so you overhear this. You go into the adjoining room and you sit down in front of the old shock generator here. And on the shock generator in front of you are labels that go from slight to moderate to strong, very strong, intense, extreme, danger, and triple X. I believe it goes all the way up to something like 450 volts. Okay? So as things progress, here's what happens. At the beginning, when you're down at the low-level shocks being delivered, the learner is getting some things right and some things wrong. And every time he gets something wrong, you need to shock him. And he's like, oh, when he gets shocked, right? In the middle here, his protests become louder. Stop it. No more, no more, no more. I can't take it anymore. Please stop. My heart's bothering me. And you're supposed to keep shocking him every time he gets something wrong. We ultimately get to the point where this guy is screaming, ah, no more, no more, no more. I can't take it anymore. My heart's bothering me. No more, no more, no more. Okay? After that point, he will stop responding. And so you're reading him word pairs, and he is no longer responding. And the white lab coat authority figure guy says, if he doesn't respond in a reasonable amount of time, count the question as being incorrect and deliver another shock. Tell me in the chat box, when the guy in the suspenders no longer responds, as far as you know, what could have happened to him there in that adjoining room on the other side of the wall from you? He could have died. So the question ultimately is here, how far are you willing to go to follow the authority figure white lab coat's orders to continue, right? And if you say things like, I think we should check on that guy, the white lab coat guy says, the experiment must continue. Please continue. Okay? But I'm worried about him. I think something could be wrong. Please continue. Next word, please. He's very firm. He's very rigid. And he just wants you to keep on going. So here is the question I have for you. What percentage of Milgram's participants do you think would go all the way to the end of the shock generator, ultimately delivering the maximum shock to the learner? Again, noting the fact that about 3/4 or 80% of the way through, the participant on the other side of the wall no longer responds. What percentage of folks do you think are going to go to the very, very end here and just keep on delivering shocks? Give you guys another 20 seconds to take a guess at that one. All right, let's take a look at our results here. your predictions for this one. As soon as I push the right button. There you go. All right, so we've got one of you saying it's going to be 10 to 25%. Most of you saying it's going to be 25 to 50%. Some of you saying it's going to be even more than 50%. What Milgram shockingly finds, and I'm not trying to be cute there with saying shockingly, is that 65% of his participants continue to deliver shocks all the way until the very end, and they don't stop. What's the take-home message here? People are incredibly obedient. If there's an authority figure there telling you to do something, we comply with those orders again and again and again, even to the point where, sadly, the guy in the adjoining room could be dead. We don't stop. We just keep going on and on and on. Whether you want to look at the results that way or in this slightly different way, what percentage of participants continue to obey all the way through? Right? This is like a survival curve is what this is called. 65%, the majority of participants continue to obey until the very end when the guy in the suspenders had no longer responded anymore. And because he was complaining about his heart, he could have had a heart attack, he could have died. We don't stop. Right? 2/3 of us go to the very, very end. And by the way, if you think Milgram's results here are some kind of historical artifact, people wouldn't do this today. This study was just replicated in the last 5 or 6 years up at Santa Clara University up in the Bay Area, and the results were basically the same, okay, where people went to that point and continued to deliver shocks all the way to the very, very end, okay? 2/3 of them did that, okay? Let me stop there for a second. Questions about Milgram's study or reactions to Milgram's study? I should go back for a second and tell you, oh, by the way, this guy wasn't really being shocked. He didn't really have a heart condition. This was all a standard set of responses that you were getting from him in that adjoining room. So more deception, right? The study wasn't about teaching and learning. It was about obedience. This guy was Confederate, and in fact, he wasn't really getting shocks. He wasn't having a heart attack. He wasn't about to die back there. But you, as far as you knew, this was exactly what was going on. You were delivering shocks. He did have a heart condition. He may have, in fact, died back there. Okay? So lots and lots of deception in Milgram's research. Why? Because to get good answers to the questions about obedience, you're going to need to go beyond, say, asking somebody a question. Would you follow orders such that following those orders might kill somebody? Everybody says no, and we learn nothing. We learn nothing at all about obedience. Let's go to our Mildred for her question. Did they know that they could stop? They were basically told to continue and told so in a very firm way. Okay, and in fact, the amazing thing about this study, I think the most amazing thing about the study, and it's amazing for a variety of reasons, is when Milgram was asked how many of the true participants, right, this guy here, the teacher, how many of them said basically, screw you to the white lab coat guy. I'm moving away from the shock generator. I'm walking in the adjoining room, and I'm checking on the guy in the suspenders. Take a guess. How many people ever did that in Milgram studies? Went into the adjoining room to check on the guy. You know how many people did that? None. Zero. No one ever did that. Okay. Now, subsequent to this, our Mildred, what happens is there's some changes in how we administer these kinds of studies and run these kinds of studies, and you're always told now that in any study you participate in, you have the option to stop. Okay. There are these things called institutional review boards, IRBs, that review any kind of study like this, any of the studies you participated in this fall, to make sure it's not going to cause a significant level of distress. Because in this study, the teachers are visibly shaken at the end of the study, and they're visibly relieved when the Confederate guy in the suspenders comes in from the adjoining room and is not, in fact, dead. Okay, so we have changed things up with respect to deception, and again, that point about always having the option of stopping and making the experiment cease at that point. Okay. Any other final questions on the study from Milgram. How about this table as my Thanksgiving gift to you guys? I'm going to leave it up, and I will share it with you again at the beginning of the session on Tuesday online. It's a social psychology research summary of the research done by Triplett, Zients, Sherif, Ash, and Milgram. What each of these guys did and what each of these guys found. When you go to study for the test, which comes up 9 days from today, this is what you should be using to review the basics of these 5 major researchers' work. Triplett's about social facilitation. Most did better, some did worse. Zients is about social facilitation research. It's about arousal. That helps if it's a dominant, well-learned response, but it negatively affects novel responses. Sherif is looking at ambiguous situations. He finds that people converge in their opinions in those ambiguous situations. Ash studies conformity. He's got confederates who give wrong answers, and more than a third of the time, you give incorrect answers. And then finally, Milgram uses lots of deception to study obedience and finds that 60% of his participant teachers continue to deliver shocks all the way to the very end, at which point there were no additional shocks to deliver, and the dude in the adjoining room could have been dead. Okay? We will circle back to this slide at the beginning on Tuesday, and then we'll move into our final segment, which is going to be about attributions, how we explain other people's behavior. So I'll leave this slide up. We will wrap up for today. I will wish you guys a super happy Thanksgiving, and I'll see you back online here on Tuesday next week. Again, test number 4 next Thursday at 8 o'clock. Make sure you're there on time. If you show up later than 8:25, you will not get a test. You will get a 0. All right? Have a great Thanksgiving, everybody. I'll see you back online here a week from today.